Hello, my name is Howard Polanski. I work with Silver Key Benefits of Texas. I help people navigate Medicare. I do this video every year, update. The first part is what exactly is Medicare? How does it work? And then I explain the changes that are upcoming for the following year. As I'm recording this, this is now the end of August 2024. Most of the changes, the big changes that you are going to want to be aware of, have already been revealed. There's a couple of things that we won't know until November. So I'm not waiting until then, but I figured it's now the right time to have this video done so that when the annual election period, the open season for Medicare, is up and running, you are now already prepared to know what is going to be happening. So I'm going to put myself here in the left-hand corner. So again, my name's Howard Polanski, and I have been working with Steve Dikovic, who founded Silver Key Benefits of Texas since 2018. I joined in 2018. Steve has been doing this since about 2014, 2015. I am also known as the Pie Guy. I have gone to various senior communities around Austin, Texas, bribe people to hear this presentation by giving away pies. This is the exact presentation that I do live. No, I will not give you a pie if you watch this video, but that's how a lot of people remember me. Here's the key thing. We are brokers. And what does that mean exactly? It means we don't work for just one company. We don't work for only United Healthcare or only Aetna or only Baylor Scott and White. We work with all of the companies. We are contracted with all of the companies because there is no one perfect plan. And so I have to be here and assess the situation and say, what is the right plan, or what do I feel is the right plan for you in your unique situation? I'll break through or I'll break down how all of this works. The other key part is there is no fee to you. We get compensated by the insurance companies. All of these insurance companies have a marketing budget. So my compensation is regulated by the federal government. So it really does not matter to me what plan you end up choosing. It just has to be the right plan for you. So the objectives with this video: an overview of Medicare. How the heck does Medicare work? And then the changes for 2025, the good, the bad, and the ugly. So let's start with the overview of Medicare. I apologize if this is not the most crystal clear of forms. It was just a copy and paste, unfortunately, but you'll get the idea. At the top, it says the word Medicare. That is to signify the United States government. Inside Medicare, there are 4 parts: Part A, B, C, and D. Part A is your hospitals, hospice, skilled nursing facility. If you can see that in the upper left-hand corner. If you and or your spouse paid into the system for 10 years or more, Part A is a $0 premium. Part B is what you pay for. That is your doctor visits, your outpatient medical procedures. Think of biopsies, colonoscopies, and your durable medical equipment, your wheelchairs, your walkers, your sleep apnea machines. In 2024, the base premium for this was $174.70 a month. It is my belief that the premium for that is going to go up to $185 to $190 per month for 2025. For Part A and Part B, Medicare will pay 80% of your medical costs. So if you go to the doctor and that Medicare price for that doctor visit is $100, Medicare will pay $80, you will owe $20. If you are like one of my clients that ended up twice in the hospital over 30 days, or within a 30-day time frame, the retail price for that was $1.25 million. The Medicare adjusted price was $250,000. I'm sorry, it was not. It was $125,000. So just for being on Medicare, it got discounted 90%. Medicare will pay 80% of the 125,000, but they would turn over to my client and say, you owe the other 20%. There is no maximum dollar amount to that 20%. You owe $25,000. Obviously, my client did not want to go through that. So how do we cover to not have a $25,000, oh my goodness moment? And now we have two ways to go about Medicare. I'm going to start on the left-hand side. I call this public Medicare. You will hear many people call it original Medicare. And this is when you get a Medigap policy or a Medicare supplement policy. Now, in the government's infinite wisdom, with Medicare supplements, they were all letters, anywhere from letter A to the letter N. So you have parts and you have plans, and they all have letters. It's a big old alphabet soup. What you need to know, all of the supplements kind of work the same. And if you are now aging into Medicare after the year 2020, the only Medicare supplement letter that you can get is Plan G. The other very common one is Plan F. They are nearly identical, but just go with me here. If you decide to stay on public Medicare and you go this route, you are going to end up with 3 cards in your wallet. The first one is the Medicare card. That is what we call the red, white, and blue card. The second one is going to say Medicare Supplement Plan G on the card. For my client, that is what paid the $25,000 for the hospital. That paid the 20%. When you're on original Medicare, you can see any doctor that accepts original Medicare, which is 99+% of physicians out there. The only ones that I have seen that do not take Medicare are plastic surgeons, a number of psychiatrists, and there was one dermatologist in Westlake, a suburb of Austin. I don't know how, I don't know why, and I don't care. Everyone else, if you're on original Medicare, you just have to call the office and say, do you accept original Medicare? If they say, yes, we do, then you can go see them. You can go to any hospital, anywhere in the country, no referrals are needed. So you can go to your primary care doctor on Tuesday, you can go to a cardiologist on Wednesday, you can go to a gastro on Thursday, you walk in, you walk out, you don't have a bill. What's the downside? The downside is that you're paying for this Medicare supplement. For someone that's aging into Medicare, it can be about $100. For someone that has been on Medicare for a while, like my late grandmother, may she rest in peace, she passed away 1 week shy of 101 several years back, she still had a Medicare supplement. It was costing her over $400 a month. Why? She's older. The chances of her getting sick or needing a doctor or a hospital is a heck of a lot higher than the average 65-year-old. And the companies that do these Medicare supplements price it accordingly. The other thing is you're going to need the third card, which is associated with Part D of Medicare, D for drugs. Makes sense, finally. It has its own separate premium, probably going to be anywhere between $15 and $100 a month next year in 2025. And there is a drug deductible. The deductible can be as high as $590 in the year 2025. So you would pay the first $590 and then the drug plan kicks in. So as we sum this all up, as we have on the bottom left-hand side of this, it is flexible because you can see any doctor anywhere in the country, no referrals are needed. There's no networks. You just have to know, do you accept original Medicare? You're good. There is a tiny annual deductible for the hospitals and doctors. And if I didn't make it clear, hospitals and doctors is one bucket, drugs is its totally separate bucket. For the hospitals and doctors, that tiny deductible for 2024 was $240. I'm estimating it's going to go up to $265 for 2025. Basically, Medicare wants you to pay for the first 2 or 3 doctor visits, and then after that, you are covered. And I have neutral, the sideways arrows, the costs are upfront. You will know this is what my hospital and doctor bill will be for the upcoming year, period, end of story. Whether you need a hospital or you don't, whether you need a doctor or you don't. And so my mom, for the first 5 years that she was on Medicare, she didn't even hit that tiny deductible. She was paying for this Medicare supplement much like you pay for car insurance. You pay, you pay, you pay. You're not looking to get into an accident, but you keep on paying. I had a different client. They turned 65 in January. In April, they got diagnosed with breast cancer. She was like, this is the best thing ever. I'm just paying my supplement. Everything else is covered. That's where the costs are upfront is a neutral thing. Now, some people are going to be like, I don't want to pay for this, or possibly I can't afford to pay for this, or I'm pretty healthy. Do I really need to pay for this? And if that's the case, we have an alternative way to do Medicare. So now we're going to go over to the right-hand side. This is the final part of Medicare. This is Part C. And I call this privatized Medicare. And this is where Joe Namath and Jimmy Walker's making all their money because what they are referring to is something called Medicare Advantage plans. And here's the key distinction. When you are enrolled in a Medicare Advantage plan, you now have a private insurance company making the decisions on behalf of the federal government. I will say it again. When you are enrolled in a Medicare Advantage plan, you are not on original Medicare anymore. You now have agreed for Aetna or for Baylor Scott and White or for Humana to manage your Medicare on behalf of the government. And so with that, they have what we have grown up with in regards to medical insurance, where there's HMOs and PPOs. So let's start with what's the upside to all of this. You're only going to have one card. That one card, you are going to show your doctors, you are going to show the hospital, you are going to show the pharmacy when you need to pick up prescriptions. The premium for this is low. It can be as low as $0. Whereas with the Medicare supplement, you're paying at least $100 and up. And dependent upon an HMO or PPO, or apologies, the other part is that drug plan, which you needed separately on the public side, is built into the Advantage plan. Now, what's the downside? The downside is that there are copays. If you go see a primary care doctor, anywhere from $0 to $10 a visit. For a specialist, $30 to $50 a visit. If you need something like a biopsy or a colonoscopy, it could be $250 to $300 for that procedure. If you go into the hospital, dependent upon the plan, when all is said and done, figure the bill is going to be between $2,000 and $3,000 for that hospital stay. Now, there's ways to cover that. We're not going to go through that here. Okay. But this is a pay-as-you-go plan. If you're healthy and all you do is see a doctor or two throughout the year, this is cheap. Pay as you go. If you don't see anyone, it doesn't cost you anything. Okay. But to be the most cost effective with these plans, you have to see doctors that are in network with these plans. Okay. And so as we sum it all up on the bottom right-hand side, it is cheaper up front. As I mentioned, it's a pay-as-you-go plan. You're paying nothing up front, but as you need things, you keep on having these copays. There are added perks. There's 4 things that Medicare does not cover. They do not cover dental. They do not cover vision, meaning glasses and contact lenses. They do not cover hearing aids, and they do not cover facelifts. So if you were expecting now that you're on Medicare that things are going to get raised or lowered and a doctor's going to do it for you, sorry. You're just going to have to rely on gravity to do this. Okay. But here are some of the perks that Advantage plans can add to their plan. They can add dental coverage. They can add a vision allowance for your glasses and contact lenses. They can add discounted hearing aids. They can add chiropractic, acupuncture, transportation. Some of them will even give you cash to take the plan. It's a perk. Instead of guessing what benefits that you want, they will say, take this plan and your Social Security will go up if you choose this plan. But the downside are the restrictions in terms of using the network. So let me give 3 very crystal clear health scenarios for you to understand the difference between the left side and the right side. So we live here in Texas, and let's just imagine that there's someone who's on Medicare and they love Mickey Mouse. And they go out to the West Coast and they're at Disneyland, and while they're there, they have a heart attack. What happens? Because a heart attack is a life-threatening emergency, it does not matter what plan you have. Left side of the page, right side of the page, you are covered. Period. End of story. Now let's pretend the next time they go to Disney World. They're at Epcot and they get shingles. Now what happens? If they're on the left side of the page, they have a Medicare supplement because they can see any doctor, any hospital, anywhere in the country, no referrals are needed. That visit to that doctor in Florida is going to be covered. If that person has an Advantage plan, dependent upon the plan could come back and say, we know shingles stinks. However, shingles is not a life-threatening condition. You are outside your geographic zone of Central Texas. That bill is all on you. Final situation. You get a diagnosis of cancer. Your next immediate thought is, I want to go to the best cancer hospital in Texas, potentially the world. I am willing to drive from Austin to Houston to go to MD Anderson. If you are on the left side of the page and you have a Medicare supplement, MD Anderson will be happy to see you. If you have an Advantage plan, MD Anderson is not contracted with any Advantage plans in the Central Texas region. If you specifically want to go there, you are paying cash to see the doctors at the MD Anderson Hospital. Please understand, I did not say that there's always going to be oncologists, there's always going to be cancer doctors in network. But if you specifically want to go to MD Anderson, you will be paying cash. That's Medicare in 16 minutes, even though we're 19 minutes into the video. So that's it in a nutshell. Let me go through a couple other parts of Medicare let me go over here the main questions I ask in terms of trying to figure out, is this individual in front of me better served being on public Medicare or private Medicare? So question number 1, do you want flexibility of doctors? If you're saying, I don't want to be dealing with networks, I want to be able to go wherever I want to see, then we are going to be leaning towards getting a Medicare supplement and staying on public Medicare. If you're like, whoever's close by is good enough, now we have a choice. Number two, do you want to minimize costs up front? As I mentioned, the Medicare Advantages, many Advantage plans, many of them have a $0 premium, and it's a pay as you go plan. If that's what works for you or works for your budget, then this is what we'll look at. And we'll make sure that we find a plan that you can see all the doctors that you want to see, plus try and figure out the drugs and the pharmacy and all of that. And here's the third question. Are you go-go, slow-go, or no-go? And here's what I mean. My parents, knock on wood, are still going. They're going around the country to see friends. They're going around the world in terms of traveling. They need to know that their insurance is going to go with them. And so this is where a Medicare supplement or being on public Medicare makes more sense. Again, going back to my late grandmother, the last 9 years of her existence on this planet, if it was not within 10 miles of North Austin, it did not matter if it existed. She wasn't going anywhere. We could have switched over to a Medicare Advantage plan and been perfectly fine. And then you have the slow go. I may take a trip every once in a while down to the coast or up to see my family, but I'm pretty much kind of being a homebody. Then we have to go back to the other questions and kind of figure this out. Some of the other things that we need to look at. Income. I have clients that are very, very restricted in their income, and I've got other clients that are very well off into their aging years. And so there's certain things that we need to be considerate of with regards to the income limits. Let's start on the low side first. If your monthly income, this is all the income that's coming in, if you are single, under $1,255 a month, or if you are married, your household income is under $1,700 a month, you qualify for both Medicare and Medicaid, where basically everything gets covered and there are special plans that will give you additional benefits. We go up another level between $1,256 and $1,506 if you're single. We're up to just over $2,000 a month if you're married. For that tier, your Part B premium of approximately $190 a month next year will be paid for by the federal government. So you would actually have a reimbursement of that in your Social Security. And for the next level up, which goes up to $1,700 a month for a single person, $2,300 a month for a married couple, your Part B premium can get paid, but you have to apply for that every single year with the state and hope that there is enough money left available that they will accept you and then reimburse you for that. If you are any of these levels, there is some help with your medications. Now let's go to the other side. For those that are high income, there is something that known as the Medicare tax. The acronym is called IRMA. I'm not even going to try and remember what it's called or what it stands for. However, what essentially is happening is the subsidy for Medicare shrinks as your income goes up. These are estimated brackets for next year. They have not officially come out yet. Again, this is one of those things that won't come out probably until mid-November. But if you are single and your income is under $105,000, if you are filing married on your tax return and it's under $210,000, all you will be doing is paying that base premium of approximately $190 a month. And where they're coming up with this number is from your tax return 2 years prior. So they are looking at the adjusted gross income on your tax return for 2023 to determine your premium for 2025. In 2026, they will look at your tax return in 2024. 2027 will look at 2025. So it's always 2 years rolling. If you are $1 over, if you're married and now you have $210,001 on your adjusted gross income, then you will be paying not only that $190 a month, you're paying an additional $74 per month for Part B, and you have on the drug side, an additional penalty of $13.70 per month. And you can see all of the respective brackets here. So if there is a couple that is making $300,000 a year, according to their 2023 tax return, essentially their Medicare is going to cost double, plus the supplement, plus the drug plan, plus this extra $35. And that's just how it works. And they will adjust this every single year. In terms of that adjusted gross income, that's going to include Roth conversions. That's going to include if you sell any stocks. That's going to include if you sold a business. That income is going to count for that year. And it can just wallop you in terms of being in a higher bracket, and then the year after you come back down to reality. Changes to Medicare. These are relatively big. Okay, let's start with the bad. So, Advantage plans. I mentioned earlier, the Advantage plans can include additional perks like dental, vision, hearing aid, transportation, chiropractic, acupuncture. These Advantage plans have gotten slaughtered economically. And it is estimated nationwide up to 90% of the Advantage plans will be lowering benefits. What does that mean exactly? If a plan for this year was offering $2,000 in dental benefit coverage, they may shrink it down to $1,200 or $1,500. If the vision allowance was $300, they may shrink that down to $150. Again, I am not looking at every plan. I am hearing from my experts and just bringing this forward to you to let you understand high level, because they haven't officially released all of the plan information yet. But if you're on a plan and you are like, oh, I need to use that dental coverage, start using it now before the year ends. Now let's go on to the good, because the ugly is ugly. But let's go on to the good. So number one, this is not great, but the deductible is going up for drug plans. The drug plan deductible can be as low as $0. The maximum it can be for 2025 is $590. So again, you'll have to pay the first $590 before the drug plan kicks in. But now let's get to the good stuff. Number one, the donut hole is now gone. This was one of those big nuisances. Everyone was up in arms about it. They finally got rid of it, thankfully. The other good, the most anyone can spend on medications out of pocket is $2,000 now. Whether that means you're done with it in February or you're done with it in December, $2,000 is the most you can spend out of pocket on the medications themselves. But let's get to the bad side of this. When you look at the statistics, less than 10% of people even went over $2,000 anyway. And so what's going to end up happening? These drug plan premiums, they're going to rise, period. They're going to rise because they're now asking everyone to share the wealth for the super expensive drugs. And not only that, they're asking the drug plan, the companies that provide the drug plans, to take on a greater burden with this also. They're not dumb. They're going to raise the premiums again and try and push this along. Now, here's one other good thing. Maybe there is now the ability to do a prescription payment plan, because the other complaint in regards to Medicare was the deductible. If you had some expensive drugs, it could be $600 to get through the deductible and then still another $400 or $500 for copays. It was $1,000 in January or February, and it totally screwed up seniors' budgets who are on a fixed income. And so now they decided to do a prescription payment plan. Here's why I say maybe. If you go to your pharmacist now and ask him, do you know anything about this Medicare prescription payment plan? They are going to look at you like a deer in headlights. Let me tell you how this is supposed to work and bring up the next slide. That first time that you go in January to pick up your medications, if you want to do this as a payment plan, you will give them this form, which I don't have, some mysterious magical form. You will hand it to the pharmacist. You will not give them any money that day, and you walk out with your drugs. And then it's going to be through the drug plan itself that is going to take the cost of those medications and now divide it out for the rest of the year for you to make this level from a budgetary standpoint. And so this is a sample of what in theory could happen. In January, there was no out-of-pocket incurred because you still had medications from December. You happened to have more than a month of them. But if you actually pick something up, let's say it was all $2,000, you happen to be on an HIV drug or a super expensive cancer drug, which it cost you $2,000 month one, you could have given this paper to the pharmacist. They would have sent it to your drug plan, and the drug plan would then basically send you an invoice for $166.67 for the rest of the year. There's your payment plan. Makes it nice and smooth. But you had enough medications, and now you picked up your medications in February. And so you had the deductible. And again, this is some insulin sort of drugs. And so it was $1,200 in terms of the total cost. You decide to do the payment plan. Well, there's now 11 months remaining. They're going to take this $1,200, divide by 11, and you're going to pay $109.09 per month to your drug plan to make up for this. You get some little drugs here over March, April, May, and you can see your monthly smoothing will go up just a little bit to make up for these respective drugs. Again, you're not paying the pharmacy at this point. You're saying, I want to do this over a payment plan. I want to do this over a period of time. Well, then you get June and August. You got some expensive medications again. Well, now this payment plan bumps up because now you have less months to pay this $530. And so it jumps from $143 to now $250 for the rest of the month or for the remainder of the year. And so this is the payment plan concept. It's going to be interesting if this works without it being a complete nightmare for everyone. I'm just sharing with you what this is going to be. Thankfully, I don't have to be in the middle of this. I just want to share with you that the possibility is there. But now let's get to the ugly. Because these prescription drug plan companies are getting squeezed, what they ended up doing is saying, you know what, Howard, you're a broker. We're not going to compensate you. This is specifically with the prescription drug plans. I'm not saying this is with every drug plan, but some of the companies have said, yep, we expect you to work for free, which kind of sucks. And so a lot of the brokers, like myself, are figuring out how are we going to do this to best serve our clients? Because this is a challenge. It's a serious challenge. Like if I'm not asking for you to compensate me directly, is it fair for me to work for nothing? I think most people would say no. Okay. But I've got my integrity. And that's the only thing I can rely on. That's the only thing that gets me to know that when I put my head on the pillow, I am going to sleep well. And so this is the way that it's going to have to work moving forward. I will still help because I can do this and figure out what drug plan far faster than you can. But if it happens to be that the best drug plan for you is one of these plans that I will not get compensated, and when I know I will not get compensated, there won't even be a little button for me on my end to hit apply for you because the software is smart enough to say, we're not even going to let you work on this because you don't get paid. And if that happens, I will email you the Medicare plan code, because every plan has a Medicare code, the exact Medicare plan name for that drug plan, and the 800 number. And then it's up to you to do it yourself. It's the only way I can make this work. If the most cost-effective plan is one that I get compensated, then we will do the normal routine that I've always done. Okay? But I will let you know up front in terms of I can get compensated on this or I can't. And I'm not asking for you to feel bad for me. I'm just giving you the whole situation of what's going on right now. And I can tell you there are some brokers that have been doing this for years and will be losing out on over $100,000 a year of compensation. All of that goodwill that they have built up with their clients, literally gone starting January 1. That hurts. That's not me. I wish it was, but it's not me. But that hurts a lot. How do we do a review? If you're happy with what you've got, you don't need to watch this video. We don't need to do anything. If you do want to review, and I strongly encourage that you do, below this video is the Google form. All of those series of questions, fill them all out. Even though you've done this years past, every single year, life changes, life happens. We don't keep in touch throughout the entire year until you say hi. Okay. So I don't know what's going on in your world. I need everything updated. The answers only come to me. If Steve decides to send this out to his clients, Steve won't see your answers. They will come to me. I'll let Steve know that you reached out to me, but I will only see these answers. The final changes have to be in by December 7th of 2024 by 11:59 p.m. That is what you will have starting January 1. However, I'm shutting things down December 3rd. I have a conference that starts December 4th, and I do not want to pick up my computer again once that conference ends on December 6th to try and squeeze people in literally on the last day. So realistically, get things done by December 1st. December 2nd and 3rd is tying up the very last little ends. And don't expect to be able to get in contact with me December 4th, 5th, or 6th. Just being upfront. This is our information. There's Steve at SilverKeyTX, Howard at silverkeytx.com. There's our phone numbers. I thank you for watching. I apologize this went closer to 40 minutes, but there was a lot of information to go through this year, much more than the last couple of years. So I thank you for watching, And if we can be of value in any way, shape, or form, happy to be here for you.